Hey guys, my name is Mike Lynn and I'm a stage 4 metastatic melanoma patient. I make YouTube videos to help with my mental health, but also to create dynamic conversations about what it's like to be a cancer patient, live with the disease, and to help, my loved ones, other people's loved ones who are interested in the topics. And today I have a pretty awesome treat. This is my oncologist, Dr. DiCarlo. Want to give a little bit of information about who you are?
Sure. So, DiCarlo, I've been a medical oncologist for about 20 years now. Trained in New York at Cornell and now work for UCLA. And I specialize in all types of different tumor types, including solid tumors and blood cancers. And I'm really happy that you invited me to join you today. I think this is what you're doing with the online community and getting the education out and talking about the issues you're talking about is really.
What would you recommend to someone who's been diagnosed with any stage of cancer? Because obviously someone who has stage 1 cancer that's hyper-treatable, the treatment is going to be different than stage 4 metastatic melanoma.
Wherever you are in the country or the world, find somebody that you can trust and really listen to their advice, number one. Number two, understand that everybody's journey is very, very different and very unique. I hear it all the time when patients come in, will say, I'll talk about maybe chemotherapy, for instance. Well, my aunt went through that, or my dad went through that, and it was horrible. I'm never doing that. Everyone is different. Yep. And chemotherapy is better than it's ever been. Not that it's easy, but it's better than it was 10 years ago. It's better than it was 5 years ago. The improvements are just so rapid that I always tell people, don't be discouraged walking in the door looking at the survival curves that are online.
Yeah, I mean, one term that we talk about often in the patient community is sample size of 1.
I like to tell patients who are initially diagnosed is that, cancer care has never been better than it is today.
Yeah.
Your chance of survival and beating the disease or living with the disease is never better than it's been today, but it will be much better in 2 years, 3 years, 5 years. So for someone with a disease like yourself, actually, that's dealing with, if it were to come back at some point, there are already going to be something better than we have now. That's just important to keep in mind.
I think a great example of that personally is 5 years ago when I was diagnosed with stage 3C. The treatments were a little different, but I don't know if it would have varied in that regard. But a good example is circulating tumor tests. That wasn't a thing we were doing 5 years ago, and now that's on the table. And we were talking before we started filming. I talked about Opdualag, which is a new immunotherapy that has been developed since, and those are two small, I think, examples. Whereas in the entire field of oncology, there's probably dozens of things.
Yeah, I'll give you one specific to you actually. So if you came to me today with what you had then. I would actually hope that I would see you before the surgeon.
Huh.
Why? Because we now have data showing that giving immunotherapy before surgery leads to better outcomes.
Awesome.
Now we know for people who have involved lymph nodes from the beginning, just as an example, giving the Opdivo or Keytruda before surgery leads to higher cure rates, actually.
That's pretty awesome.
And the reason for it, we think, is because immunotherapy works better when the enemy is in place still.
So your immune system can learn from developed cells or whatever?
Yeah, well, it can see the neoantigens.
Yeah.
Right? So the neoantigens meaning the proteins that are abnormal and unique to the tumor that the immune system can respond to and recognize as foreign and attack. If you give the immunotherapy to stimulate the immune system while the tumor is in place, there's a higher chance you'll get that response.
Got it.
And we're actually seeing that in lung cancer too now, where we're giving immunotherapy before any lung cancer surgery with marked improved outcomes. That's one of the major advances in the field going forward.
How integrated is mental health stuff into your practice?
Not enough, actually. It's something that I'm always thinking about and trying to improve on. And it's one of those things where you have to bring in sort of the multidisciplinary team. I'm definitely not a mental health professional. That being said, I feel like I'm fairly attuned to it.
Yeah, you definitely are.
So, I tell patients, this is as hard as it gets, right? So that's one thing. Second is to bring in the mental health professionals. We just hired a fantastic social worker, and through our connection with UCLA, we have this whole center that helps with that kind of thing. Can talk and have counselors and a lot of online stuff too. So it's something that needs to be addressed because it really has to do with quality of life.
What would you say to someone who wanted to know like lifestyle tips for getting through cancer treatment, you know, both on an individual basis, but also for like friends and family members who want to help someone, at least from a mental health standpoint, but like, are there things you would recommend, like, you know, diet and exercise related, or, you know, the thing I tell people is like, drink as much water as possible. I promise you that that's the right move. You know, there's no downside to that.
That's just true.
Like,
yeah. I would say number 1, 2, and 3 is exercise, exercise, exercise.
Yeah.
It's, you know, it's nothing sexy or you know, it sounds simple, but the people, I see it, you know, treating hundreds and hundreds of patients. The folks who exercise regularly do better.
Yep.
And from a physical perspective and from a mental health perspective. You know, that's easier said than done when you're feeling down. Yep. And you know, I always tell patients, you know, it doesn't have to be a lot. It just has to be something modest. You know, so for, let's say, an older patient going through some chemotherapy that is fairly difficult, a lot of fatigue, right? Yep. I just tell them, hey, if you can get outside for 5 or 10 minutes, you won't believe how much that will make a difference. Just walk, you know, down the block. Or
How would you assess my case? It's you know, if you were going to describe my case to someone who isn't me, or just to give me like your actual thoughts on where I'm at.
And I'm being honest here.
Yeah.
I expect you to survive this long term.
Yeah, which is insane to hear. Well,
yeah.
Like,
and I can't guarantee that.
Yeah, of course.
But I think
you
chances,
promised.
Exactly.
If I die, I'm going to haunt you.
right.
No matter what.
Exactly.
Either I'm immortal or you're getting haunted. Those are your options.
Exactly. Yeah. Either way. But you know, the reason I say that is not every stage 4 is created equal.
Right.
It depends on what disease it is. Stage 4 pancreatic cancer, for instance, is very difficult compared to melanoma. Also, in your case specifically, you had fairly isolated disease. It's no question people do better when there's 1 or 2 spots of disease, as opposed to, you know, a liver full of metastases, for instance. You know, so that in combination with the amount of autoimmune side effects that you got, and how quickly the disease went away radiologically. I think your prognosis is actually quite good.
Not every like I said, I was like, oh shit, am I forgetting to ask this? Yeah. Man, that was awesome. What an incredible opportunity. I really want to thank Dr. DiCarlo for taking his time and sitting down with me. It was very educational, and I hope to do a lot of things like these in the future. Big shout out to producer Joey for helping us get this done as well. Let me know how you think this went. Let me know if you want to have some other questions answered. Make sure to like this video, subscribe to my channel, and leave a comment down below if you have specific questions that you want me or hopefully Dr. DiCarlo in the future to answer. This was an awesome time, and I look forward to doing it again. Thanks for watching. Bye. Now is not the way I talk in real life, and I want to get it there. And like,